The topic I'm going to talk about is an important one, and it's about removing impediments that ultimately hinder access to care, out-of-state care for children who really need that care. And just since I wear a number of different hats, this is work that my colleagues and I have been doing for several years now on behalf of Boston Children's Hospital, and it's work that is supported by a number of other stakeholders, but just wanted to make that point known as to why I'm here on this particular bill for this session today. And this is of particular importance to rare disease families, given the frequent needs that many of us have to travel to out-of-state care for highly specialized care, just given how care is often organized. So let's move on to the next slide here, go into a little more detail. So we are talking more specifically about the difficulties obtaining out-of-state care for kids who are on Medicaid and CHIP, when their care needs cannot be addressed by providers in their own state. And this is particularly about the delays that occur today with regard to screening and enrolling providers. I just want to make that point clear because I know there are a number of issues in the Medicaid and CHIP context around expansion and eligibility and all that on the patient side. But for this purpose, we are talking about the important component of the provider screening and enrollment in this particular set of issues that we're working with. So current law and regulation today permit, and CMS guidance even encourages states to use screenings that are done by other state Medicaid programs or by Medicare to facilitate enrollment of providers when they have to care for a child coming from another state. But the reality is that, unfortunately, it's a bit of a patchwork quilt of screening enrollment policies that vary significantly by state, and that's why we're working on a federal solution to address this part of this particular problem that today is, again, impeding access to care. We'll move to the next slide, because that's how, getting back to the aptly named Accelerating Kids Access to Care Act, this is bipartisan legislation that would establish a voluntary pathway that eligible providers can use to then expedite their enrollment into other state Medicaid programs if they're called to care for children whose needs cannot be met by in-state providers. It builds upon those existing authorities that I referenced, but we'll move a little further than what we can do today under existing authorities by creating this actual pathway. And it is focused on this targeted but still important piece of this pipeline around provider screening and enrollment. It is not a panacea for every single out-of-state challenge. We've never tried to take on everything in a single bill, but we are trying to address this targeted and important area of the pipeline through this bipartisan bill. Move over to the next slide. So just a little bit of background here. This is legislation that was first introduced in 2018 by Senators Grassley and Bennett, and at the time by then Representatives Joe Kennedy from Massachusetts and Jamie Herrera Butler from Washington. This came after a couple of years of working to kind of fully understand the issue, have extensive discussions with HHS to understand current authorities and kind of where the gaps are and what we ultimately need to do through legislation. It has enjoyed very strong support over the years, including, a quarter of the Senate last Congress and more than 100 House members as co-sponsors. The current bill is still led by Senators Grassley and Bennett, and now we have our new House champions, our Representatives Marinette Miller-Meeks from Iowa and Lori Trahan from Massachusetts, and we're fortunate to have more than 30 senators on board this Congress and upwards of 40 House members so far after being introduced just a few months ago. It also has enjoyed very strong external support. I think we have more than 200 and some odd organizations that have come on board. This includes other hospitals, hospital organizations, other provider groups, as well as a number of patient groups, particularly in the cancer community and rare disease, given the importance of this bill to the communities. And it is very much on the radar of key committees, and we are very, very hopeful that we'll have action later this Congress. So we'll talk more about that too. Move on to the next slide, and we'll go a little deeper into what the bill will actually do at a very specific level. So this will establish a pathway that providers can use. It's on a voluntary basis. So if a provider does not want to go through this pathway, they do not have to do so. But if a provider does opt to be screened through this pathway, then the whole point here is that they will be eligible to be enrolled in other state Medicaid programs if called upon for their eligibility period, which the bill puts at a 5-year window. The whole idea here, again, is to avoid having to do multiple screens that are redundant and burdensome. We're not trying to take away screening. We want screening to be done well. We don't want bad actors to come into the program, but we're trying to do a thorough screen right, do it well once, do it right, and then remove these barriers that, again, today are ultimately impeding access to care. And then it also sets eligibility criteria, including that providers have to pose the most limited risk for any fraud and abuse issues, be enrolled in either Medicare or their home state Medicaid program, and certainly not be excluded from any federal health programs. So that's, just again, very important point we wanted to make sure that we're very clear about. Move along to the next slide. And this is just a little visual just to give everyone a sense as to how we're thinking about this, showing, again, on the top end, you'll see barriers that can vary widely, and you'll see everything from really short enrollment periods to really burdensome and lengthy applications, paper-only applications, requests for information that are not even required by CMS. So really just trying to be, if you think about the challenges that are there, what this bill will do is try to minimize those, to do a thorough screen, and then be more able to efficiently enroll providers if they are called upon to care for a child from another state. So again, it tries to take some of that time out of the process when we know time is of the essence, particularly in these emerging cases. So just again, we like to put this together as a way to kind of visually think through what exactly we're talking about here, since I know this is not a topic that's often top of mind to many staff up on Capitol Hill. Go over to the next slide, and we'll couple concluding thoughts, and we'll move it along. Importantly, there are things legislation also does not do, and there are a few points that we like to be very clear about here. This does not take away the authority of a state Medicaid program to authorize out-of-state care. That still very much resides with the state Medicaid agency. It also does not set any payment rates for out-of-state care. That would have to be determined based on a negotiation between the Medicaid agency or MCOs and accepting providers. And it also, very importantly, does not seek, we're not trying to diminish any capacity of Children's Hospital capacity in any states. It just recognizes that a lot of pediatric care, particularly for highly specialized care and rare disease, is increasingly regionalized, and we try to reduce those barriers that today impede access to that care. So we like to make sure we're usually talking about what a bill will do, but we need to make clear in a few of these points what it won't do, just to make sure everyone has a full context and understanding. Next slide, please. And just a few other points for context. Again, this has been something that we've been engaging with the department and CMS with for several years now. And CMS ultimately came to the conclusion that we needed to have a piece of legislation authorize this pathway. We've had productive discussions with administrations from Presidents Obama to Trump to Biden. So there's been a lot of support here that has spanned political gaps. And we've had even some pilot activities that are moving toward more centralized screening. Again, this gets a little more detail, but Medicare or CMS has been moving to expand its own physician enrollment system, which is called PICOS, to a PICOS 2.0. So that can actually move into supporting multiple programs. So again, there's a lot of positive foundational elements here that we are seeking to build upon. And this bill is very consistent with ongoing agency activities. So move on to the next slide. A couple final points here. We are, again, working closely with our committees and our legislative champions. One of the most kind of core issues we're working on right now is trying to continue to inform how the Congressional Budget Office will assess the cost of this measure, trying to provide some more detailed data to help them understand, again, the small nature of this population broadly and how the system currently is operating today in terms of the barriers to care, the delays to care, the costs that are incurred when care is delayed, and just to ultimately try and inform better their thinking to update some prior projections that were very preliminary in nature that came out to kind of reflect the total cost of this bill. And our goal is to try and achieve enactment this Congress, and we remain optimistic that we'll get there. And then just to kind of next slide, final couple points about things organizations can do to be helpful. Certainly weigh in with your members of Congress to seek that they co-sponsor this legislation if they are not already on board. Again, it's S2372, HR 4758. If they are on board, certainly you can thank them and you can make sure their office knows that this is important to you and your organization. You can weigh in with committee staff so they're well aware of the number of groups and the multitude of organizations who are supportive. You can sign on to any of the stakeholder letters that are out there, and we can help facilitate that. And I think importantly, provide, we're always looking for more strong examples of situations where care was delayed, particularly for Medicaid and CHIP beneficiaries, and where that care delay resulted in challenges both in terms of less optimal health outcomes as well as higher or a greater cost. So always interested in more anecdotes so we can help inform further CBO and other understanding of this legislation and its need. So with that, I think I'm done with my session, and I'll turn it back over to you, Lisa, and look forward to the discussion later in the briefing.